So, good day everyone. Today we are going to talk about something important in our body, the jaw joint or the temporomandibular joint, which we call it as a TMJ for short. So, there is a condition related to TMJ that is known as ankylosis. So, ankylosis might sound a big word, but it simply means a joint that becomes very stiff and that cannot move properly. That is TMJ ankylosis. So think of TMJ like a hinge that helps us open and close our mouth smoothly. But sometimes, due to certain reason, this joint can really get stiff or even stop moving altogether. So that is what we call it as ankylosis. So ankylosis, a situation where our jaw does not work as it should. So ankylosis happen when something goes wrong with the joint. It can be so the term ankylosis. Remember, it means it is a pathological condition where the mandible uh, it is fused to the fossa by bony or fibrous tissue. So ankylosis, it is a Greek word that it means stiff joint. Now the ankylosis, it happens when something go wrong with our joint. So it can be due to a few things like injuries, infection or diseases affecting the joint. So these problems can make the joint freeze up or fuse together, that make it tough to open our mouth or move our jaws comfortably. Now imagine having difficulty chewing your food uh, or not being able to speak properly because your jaw does not move well. That is what the people with ankylosis might experience. So let's break down ankylosis of TMJ. The ankylosis of TMJ, it refers to the fusion or the stiffening of the jaw that essentially limits or completely stops its movement. So just picture this, your jaw being unable to move as freely as it should be. So this condition can cause significant issues with your jaw functionally, uh, from restricted movement to even the inability to fully open your mouth. Now ankylosis, it interferes with the mastication, speech, oral hygiene, or the growth and the development. So ankylosis occurs due to various reasons. It might be a result of trauma. So the most common cause is trauma, infections, or developmental problems affecting the particular joint. So when we are talking about the intra-articular TMJ ankylosis, we are referring to the fusion or adhesion between the condyle and the glenoid fossa. Now here interesting trend in the some part of the world, like in the western countries, the incidence of the TMJ ankylosis seems to be decreasing. So this decline is it is due to the better management of the jaw fracture and a decrease in the middle ear infection, mainly due to the introduction and widespread use of antibiotics. However, in countries like the India, the incidence of TMJ ankylosis, it remains relatively high. So reported case range from as early as 2-year old to late as 63 years of age, with the onset uh, often observed between the age of 10 to 15 years of age. So this indicates that the condition can affect the individual from very young age, uh, and impact their jaw function as well as growth. So managing TMJ ankylosis, it is a complex process that involves a team of specialists including oral and maxillofacial surgeons, orthodontics, and sometimes physiotherapists. So remember, for your entrance exam, the childhood trauma or it is considered as the major cause of the ankylosis. Now the ankylosis, it can be either defined as true ankylosis or the false ankylosis. So we have to distinguish between the false ankylosis. So this categorization refers to whether the joint is actually fused or just appear so due to the muscle spasm or the scarring around the joint. The true ankylosis, when there is fibrous or osseous adhesion between the surface of joint, and false when the ankylosis is due to other pathologies that are not directly related to the joint. The intra-articular ankylosis refers when the fusion between the actual articular surface, when there is a fusion between the actual articular surface of the joint, whereas the extra-articular results from the issue affecting structures outside the joints itself. Now let us talk about the nature of fusion or the union within the joint surface. They can be either fibrous or union or bony. The fibrous ankylosis involves the fusion of joint by the fibrous tissue, whereas the bony ankylosis, it refers to the fusion that is caused by deposition of bone between the head of condyle and the glenoid fossa. So when we discuss whether the ankylosis affect one side or both side of joint, we refer it as unilateral or bilateral. Now what are the main causes of TMJ ankylosis? Remember, the two primary factors stand out as major contributing to the development of TMJ ankylosis. The first is the trauma and other is the infections. So according to the report by the Topasian, 26 to 70% of TMJ ankylosis were linked due to the trauma, while the 44 to 68% were associated with the infection. Infection can arise secondarily due to the septicemia resulting from the conditions such as osteomyelitis, that is infection of bone and bone marrow. Other systemic infections like septic sore mouth, scarlet fever, tuberculosis, meningitis, and similar illness, they can lead to joint infection affecting the TMJ joint. Now the infection within or around the joint can cause inflammatory response, leading to damage or scarring of the joint tissue. If it is left untreated or inadequately managed, these inflammatory processes can ultimately result in formation of the fibrous joint or the bony deposit that can lead to fusion or the union of the joint surface. That is a hallmark of TMJ ankylosis. So remember trauma, it is significant factor in the development of TMJ ankylosis. That includes the injuries or damage to the joint area due to accident, fractures, dislocations, or the surgical procedure involving the joint or the joint itself. Trauma, it can disrupt a normal structure and function of joint, leading to fusion of the joint surfaces. Firstly, the joint infection, it can arise in the several ways. They might result from the systemic infections like the osteomyelitis, septic sore throat, scarlet fever, tuberculosis, meningitis. So these conditions can lead to bloodstream infections that may affect the TMJ. Moreover, infections, they can spread directly from nearby areas. Infections from the middle ear infections, osteomyelitis of temporal bone, parotid abscess, skin infections, all can extend to the TMJ that can cause inflammation and damage to the joint structures. Moving to disease that affect the joint themselves, conditions like rheumatoid arthritis, ankylosing spondylitis, arthritis. These are the degenerative diseases that can bring about changes within the TMJ that may lead to destruction of the joint, a disc, and subsequent repair process. So these changes can ultimately result in the ankylosis of TMJ, limiting its movement and functionality. Now let us talk about trauma. A significant percent of TMJ ankylosis can arise from the traumatic injuries, like even at birth. Trauma to TMJ might occur, like due to the forceps injury. Trauma during the prenatal life can lead to congenital ankylosis, affecting the joint development from an early stage. Later in the life, facial injuries involving the fracture of the condyle neck head can contribute to ankylosis. So direct impact on the joint chin area can lead to bleeding into the joint space. So this hemorrhage can initiate undesirable changes, including the blood clot and a deposition of the bone. So if the jaw movement it is restricted for extended period, fusion between the joint surfaces it can occur. Individual prolonged immobilization following the condylar fractures, especially in the children with their rich blood supply, increases the risk of bleeding into the joint space. That can also lead to the ankylosis. So when the trauma occurs, there is significant injury to the TMJ that leads to the leakage of blood into the joint space. So that is known as arthrosis. So over the time, if the joint remains immobilized for extended period, there will be initial fibrous band that forms due to the trauma that can progress further. These fibrous bands may mainly lead to the bony concentration or ossification, further restricting the joint movement. So what started as an response to injury with the fibrous band may result in the formation of bone, resulting in the fusion of the joint space. In the case of intra-articular ankylosis, where the fusion occurs within the joint itself, several changes can take place. The meniscus, that is a structure that helps to cushion and stabilize the joint, undergo progressive destruction. So this destruction can cause flattening of the glenoid fossa and thickening of the head of condyle. So that results in narrowing or even complete obliteration of the joint space. In some cases, the bony fusion may extend beyond the joint space. It can involve the other structures like the cranial base, sigmoid notch, zygomatic arch, and even part of skull. So these are the mechanism of TMJ ankylosis. It can occur due to the trauma that could lead to the bleeding, hemarthrosis with the formation of connective tissue, and could lead to fibrous or bony ankylosis. Similarly, the infections that can lead to fibrocartilage reabsorption and ultimately lead to fibrous or bony ankylosis. Now, we classify the TMJ ankylosis can be classified based upon the Topazian or the Sonic classification. Topazian classification, stage 1, when the ankylotic bone it is limited to the condylar process. So this one is stage 1. This one is the stage 2, when ankylotic bone extended to the sigmoid notch, and stage 3 is when the ankylotic bone it extends to the coronoid process. While Sonic classification is type 1, type 2, type 3 and type 4. The type 1 is extensive fibrous adhesion around the joint. So you can see a fibrous adhesion around the joint. Type 2 is more bony fusion at the outer edge of the articular surface. So outer edge of the articular surface, but there is no fusion within the medial area of the joint. Third is the bony bridge between the mandible and the temporal bone. So when there is a bony bridge formation between the mandible and the temporal bone, it's the type 3. And type 4, when the joint it is replaced by mass of bone, it's the type 4 classification. Other is Al-Hakim classification, class 1, class 2, class 3 and class 4. Remember that. Now how can you diagnose this ankylosis? Identifying a TMJ ankylosis involves a thorough clinical examination, typically restricted oral opening or completely inability to open the mouth. It's the key feature. Patient often complained of difficulty in chewing due to this limitation. Movements like protrusion of jaw, they are not possible on the affected site. While palpating the joint, one can often detect the partial mobility or complete immobility of the condyle. In the young patient, the nature of the facial deformity, it can help to differentiate between the unilateral and bilateral involvement. An interesting point to note is that the individual in whom ankylosis develop after full growth completion usually do not exhibit facial deformity. The unilateral ankylosis is typically observed in children or individuals where the condition began in the childhood, presenting with the distinctive sign and manifestation. The most evident sign is the facial asymmetry. So most evident point, it's the facial asymmetry that you can know that you can notice. So due to the restrictive movement of the affected side, there is often deviation of the mandible and chin toward the affected side. The chin may be receded with hypoplastic mandible. That's the feature of the unilateral ankylosis. There is rounding, and the symmetry can lead to rounded and fuller appearance of the face on the affected side. So you can see the fullness on the affected side. The unaffected side may grow flatter, elongated. This side is flatter, elongated due to the compensatory growth. Apart from that, you can see a concavity along the lower border. So this concavity along the lower border of the mandible, it's the antegonal notch. So the diagnosis of TMJ ankylosis, it is based upon the history. It is important to differentiate between the true and pseudo ankylosis. History of trauma directly to joints could lead to injuries that may result in ankylosis. Ear infections, history of ear infections, that is otitis media. So chronic or severe ear infection, especially if left untreated, can lead to nearby structures that results in TMJ ankylosis. So there could be inflammatory process or infections near the joint that can lead to ankylosis. Forceps deliveries during the childbirth can lead to pressure on the baby head, and that can lead to trauma or injury to the TMJ. Extracapsular causes like conditions like zygomatic arch fracture, oral submucous fibrosis, they should be ruled out. The clinical examination involves the imaging studies like X-ray, CT, MRI that can be done. The clinical examination of patients suspected of having ankylosis involves assessing the various signs and symptoms related to the clinical findings. There could be restricted mouth opening. So one of the primary indication of TMJ ankylosis is limited range of motion in opening and closing mouth. The patient will experience significant difficulty in opening their mouth that would lead to restricted jaw movement that can interfere with the speaking, eating, etc. Other is the obstructive sleep apnea. There is an observed association with the TMJ disorder, particularly the ankylosis and the obstructive sleep apnea. So that condition involves interrupted breathing during sleep due to temporary collapse or obstruction of the airway. So this altered anatomy and restricted jaw movement, it can contribute to the airway blockage that results in the obstructive sleep apnea. Patients are often seen with craniofacial syndrome, skeleton deformities. So these all can involve the abnormal growth or development of the facial bone that can impact the TMJ structures or the function. Psychological stress, chronic pain, functional limitations, especially ankylosis, anxiety, depression, psychological distress can also challenge in performing the oral function and also alter the facial appearance. A scar over the chin might indicate a history of trauma or TMJ ankylosis. Now what are the diagnostic methods that we can use? One is the OPG we can use. Other is lateral oblique view. That helps to view the anterior posterior dimension of the condylar mass. It is useful to evaluate any elongation of the coronoid process. Other is we can use CT scans that we will discuss later on. Now what are the types of ankylosis? Ankylosis can be either unilateral or bilateral. So imagine someone with an issue that is known as unilateral ankylosis. That means the one side of their jaw is not moving properly. So what are the things that you will notice about their face? First of all, you will likely see that their face is not quite the same on both sides. There is facial asymmetry, which means one side looks different from the other. So one of the key signs of this condition is that their chin looks like a pointing or leaning more toward the side that's affected. So the chin is deviated to the affected side. That is the feature of the unilateral ankylosis. However, on the unaffected side, there will be elongation and flattening on the other side. So you can see so this one is the affected side. So chin would be deviated to this side. There would be fullness on this side, whereas on opposite side there will be flatness. So on the side where everything is okay, you might see something a little bit flatter and longer than the other side of the face. So well-defined antecolon notch, it is present in the unilateral ankylosis. When someone has this condition, the joints on the affected side does not move as it should. So if they try to open and close their mouth, their side does not move as much at all. So the movements of joint, they are pretty much absent. So because of the jaw, they not moving properly on one side, it can affect how the teeth they come together. So that might have what that is known as unilateral posterior crow's bite. So in the unilateral ankylosis, what you will see is the facial asymmetry. Ankylosis affecting the one side of jaw, leading to facial asymmetry due to the imbalance in the jaw, growth and function, the deviation of the mandible and chin towards the affected side due to the restricted movement that causes a shift in position of the lower jaw. The chin is receded on the affected side. The affected side may exhibit hypoplasia of the jawbone leading to receded chin and a smaller mandible. There is roundness and fullness on the face on the affected side. The affected side may appear fuller or rounded as compared to the unaffected side, as discussed here. Whereas the opposite side is flattened and elongated. So in case of the TMJ ankylosis, where there is restriction in the jaw movement, the depressor muscle which pull the jaw down and become relatively stronger compared to the elevator muscles that lift the jaw. So this balance in the muscle function can cause the depressor muscle to exert more pressure on the lateral aspect of mandible, leading to noticeable concavity or the notch. So that is known as an antegonial notch. So this antegonial notch, remember, it is well defined in unilateral ankylosis and it is prominently bilaterally seen in case of bilateral ankylosis. Now, in the bilateral ankylosis, the mandible is symmetrical and it is micrognathic. So when someone has this condition, they gradually find it harder and harder to open their mouth. It's like the space between the front teeth, it gets smaller and smaller over the time. So that causes the face to look like a bird face when the chin appears to pull back or recede. So this one, the chin, it's pull back, that leads to bird face appearance. The mandible is retrognathic, the antegular notch is bilaterally seen, and there is inability to open the mouth. So their mouth is it's tough for them. It's often less than, mouth opening is often less than 5 mm wide. So that makes it challenging to open, eat or speak comfortably. Apart from that, there is a reduced or absent neck-chin angle. So the angle between the neck and the chin, it's almost reduced or entirely absent due to the restricted jaw movement. The patient with the bilateral ankylosis commonly presents with the multiple caries of teeth and poor periodontal health due to difference in the oral hygiene maintenance and limited access for the dental care.